neither our government nor even big pharma are that good at organizing big things flawlessly.
Exactly. Yes.
They're just not competent. This is was a bipartisan effort. It started under the Trump administration, and the distribution was left to the Biden administration. If they're tempted to fake the early research, at some point the vaccine will be out and it will be studied by people who aren't under their control.
We are pleased to be joined by Dorit Reiss, professor of law at the University of California College of Law and vaccine researcher and advocate. I want to first thank you so much for taking the time to speak with us for the second time now.
Thank you for having me again.
Yeah, always our pleasure, always a great time. I want to start by talking about the testing that vaccines go through. I think there's a lot of confusion about this now from frankly misinformation circling about it. Could you speak to the thoroughness of the testing and the phases and such that vaccines go through before ever reaching the market?
Sure. So I'm going to start with the technical legal issue, and I'm sorry for doing this, but unlike most drugs, vaccines are regulated under two legal framework. So all drugs that go through the FDA have to go through three phases of testing under the FDA's Food, Drug, and Cosmetic Act and regulation. Vaccines are defined as biologics, which means they're substances that are made in live cells.
Mhm.
So they are subject also to the Public Health Service Act, which adds another layer. What does that mean? Most products have still to go through clinical trials in humans before they get to the market. In addition to those trials, vaccines also have to have the manufacturing facility licensed,
Mhm.
and they go through lot testing. So every batch of vaccine has to be tested before it goes out. That's not true for pills. Pills just go through the regular licensing. So how does a vaccine get to market? So the first stage is someone has to identify which virus or germ causes the disease, and that can actually take decades. Because, for example, for HPV, the human papilloma virus, it took a long time until they realized that it can cause cancer. So first you have to identify the germ. Then someone has to create in the lab a vaccine candidate. That's a complicated question by itself because you have different type of vaccine. Once you've done those two, that's where the law comes in. There you have to do a number of tests before you can test it in human. To test it in a human, a company has to submit to FDA investigational new drug application, so
Mhm.
IND, and they have to have toxicity studying, pharmacological studies, and etc. before they ever give it to any person.
Yep.
Once the FDA approved the investigational new drug application, you can start clinical trials. And then you usually go through three phases of clinical trials, but it's not, it sounds like it's linear, but in reality, sometimes they combine phase one and phase two, or phase two and phase three. The first is in a small number of healthy humans, and that is first to check different doses of the vaccine and to see that there's nothing horrible that happens to those humans in the first round. The second is several hundreds humans, and that's again safety and effectiveness. But the drug can't get to market. The vaccine can't get to market unless it undergoes large third phase trials, which are trials in thousands or even tens of thousands of people. So you test the vaccine in those groups, and then you submit a big packet of material to the FDA. Normally, and the pandemic was different, and I'll talk about the pandemic in a moment, the FDA takes at least 10 months to review that material, and then they either license it or they don't.
Mhm.
They usually consult, they have a committee, an expert committee that they consult with, but it's also the expert in the FDA. COVID was different because it was a pandemic. There are three things that made the difference. One is that we've been studying some of this for decades, because there were previous coronaviruses that created real dangers. Coronavirus has been studied for 20 years at that point, and so has mRNA technology. So we had a body to work from. We weren't starting from scratch. We had a lot of people tested very quickly, so it was faster. They went through a very big trial there,
Mhm.
but it was faster. After the vaccine is licensed, we don't end the review. Manufacturers have to do what's called stage 4 trials after it gets to licensing. And those trials can be much bigger because now you're giving the vaccine to millions of people.
Yep.
They're not clinical trials. You're not giving placebo and vaccine, but you're looking at people who got the vaccine and people who didn't. And you're looking at a lot of medical potential reaction. And you're seeing if the vaccine has harms let's say, so in the trials, if you have 70,000 infants, you can identify something that happens in 1 in 10,000, but you won't identify something that happens in 1 in 100,000.
Mhm.
Now remember, a 1 in 100,000 serious event still won't change the risk-benefit balance. If it's so rare, the vaccine is still should be out,
Yeah.
but you'll only catch those things once the vaccine is given to millions of people.
Yeah, no, I was going to say that was great. You answered a bunch of what my next questions were going to be about COVID and testing after it hits the market. I guess to drill in on one of those, just to give you the chance to explain more. A lot of, like you actually correctly pointed out, a lot of the pushback I get is people trying to tie when they speak of it, they'll say like big pharma, tie it into these big manufacturers and corporations, and it's
Mhm.
usually something along the lines of how can we trust it if they're the ones paying for the research? Could you explain, I mean, through the
Yes.
rigorousness, the different layers, how this is trustable, like we can lean on the research in this regard?
Mhm. If they're tempted to fake the early research, at some point the vaccine will be out and it will be studied by people who aren't under the control.
Mhm.
Pulling the vaccine after they invested the hundreds of millions or billion of the large trial is a lot more expensive to them than killing it early. So there's that, but there's also the fact that these are regulated, and the what usually happens is big pharma contracts to companies that are expert at running clinical trials, because again, they may not want us to know what's going on, but they want to know what's going on. They want to have that data to know if it's worth going forward or not. So they go to third parties who run the clinical trial sites, and they pay them. Um, and the people managing the trials tend to be people who that's what they do. They run clinical trials. It's its own expertise. So there are several layers, but the main layer we have for oversight is actually after the vaccine comes to market. Remember, vaccines are given to millions of people, and they're not just in the US. The same vaccines are used in other countries. So let's say we believe that big pharma controlled all the universities in the US and all the groups of researchers. I don't think so, but let's say that's the case.
Mhm.
They don't control the government of Sweden, France, Japan, etc., who are all going to look at this vaccine and are all going to do their own studies because they don't want an unsafe vaccine and they want vaccines that work. So one way or the other, within a few years of the vaccine being out, it's going to come out if there's a problem, simply because big pharma can't control the entire world, and we have data coming from all around the world. We shouldn't trust big pharma alone. I mean, they're like other companies. Their job is to make money for the shareholders.
Mhm.
However, for vaccines, because of the nature of the product that's given to a lot of people, and because it's given in many countries, we're going to have data coming from all kinds of sources, and together that should help.
I completely agree. That's kind of what I point to often is separating the research from big pharma. And when research like cross confirms from multiple sources, like the likelihood that that's orchestrated behind the scenes is really low, to say the least. You did touch really heavily on COVID. Before we move on, though, I do want to maybe allow you to like put it all in one place, because if we skip over without talking about COVID, that's what all the comments on my channel will be. Yeah, so you spoke to how there was decades of research. Obviously, like I think even Fauci spoke to how he was doing research back like 20 years ago. So
Yes.
tons of research has gone into this. And then with the help of government funding, could you maybe just briefly walk us through how the COVID, it's not like a novel thing we've never done before,
Yes.
has the same efficacy of other vaccines?
So in 2000, we had another coronavirus outbreak, the first SARS outbreak, and that coronavirus had much higher fatalities, but was much less good at infecting people and jumping from people to people. So we had the first outbreak was SARS, and people were really scared because I think the mortality rate, and don't catch me on that, I might be wrong, was close to 50% on that virus. It was a
Wow.
really dangerous virus.
Mhm.
So at that time, people starting investing in studying coronaviruses. They said these are the next kind of big thing. So a lot of labs were created who focused on coronaviruses and have been studying them for 20 years. So our COVID surprised us in many ways.
Mhm.
But when we got to that point, we had people who said, we've been studying coronaviruses for 20 years. Here's what we know. It might not apply to this virus, but here is what we know already. And as you correctly said, the government agreed. And remember that this is was a bipartisan effort. It started under the Trump administration, and the distribution was left to the Biden administration. There were although right now we see a more partisan flavor to attitudes to the pandemic, the vaccines were created by two administrations across time, and the people running it were actually not the usual HHS. They were people from the Defense Department that were leading it. Going back to your point about you'll need to control everything, remember that neither our government nor even Big Pharma are that good at organizing big things
Exactly.
flawlessly.
Yes.
They're
Yes.
just not competent enough to be able to pull off this kind of grand conspiracy. Never have been. But as you're correctly saying, we had government put in a lot of money. Government paid, I think, three companies, because I think they also paid AstraZeneca for the research. They didn't pay Pfizer for its research, but they paid for the trials and for the distribution. And they bought, I think, several hundred thousands of, 700 millions doses of vaccines going in